All right, so guys, why would my hospital want their own specialty pharmacy?
First thing that comes to my mind is keeping the patient care within the hospital system. So when you have a specialty pharmacy on site, you can ensure that those patients are cared for appropriately. You can monitor the patients. You can make sure they actually receive the medications prescribed. And then, on everybody's horizon now, especially if you're a 340B covered entity, is the manufacturer restrictions. So, when you have a pharmacy on site, you do get access to the 340B pricing despite their restrictions.
So tell me a little bit about, what does that mean for a patient to go to a pharmacy on the place where they had care? I mean, is it a big deal for patient satisfaction? Is it nice to have or a have to have? What is it?
So one of the things I think about is if you're getting your care at your hospital, you're going to a clinic near your hospital, why not also go get your specialty medications right there on the hospital's campus? One of the big things with it being right there on the hospital's campus is your provider can send the prescription over to the pharmacy. You know already that it's going to be covered, that you're going to be getting your benefits and your financial assistance taken care of, and then you're right there at the door of the specialty pharmacy in the same visit and able to get your specialty meds.
So is there some benefit for that provider as well? Like maybe in a provider pharmacist relationship type piece? I mean, is it helpful to know who your specialty pharmacist is, or is it kind of something you're used to not knowing and it doesn't really matter that much?
I think that it is very beneficial and impactful. One of the things we make sure we do when we build up and begin a specialty pharmacy is build relationships with the clinic team. So, we have pharmacists that we choose carefully based on their personalities for not only patient care, but also for integration into the clinics. And through those relationships, any issues, maybe we do patient assessments, clinical monitoring, that type of thing. So any issues that arise when monitoring a patient, doing the assessment, or even access to the drugs, again, back to that, are resolved more easily when you have those relationships with the healthcare team.
You also have a one-on-one relationship with your pharmacist. You're going to have a pharmacist with you every step of the way, making sure you know how to administer your medication, making sure you're getting your refill when you're supposed to. You'll get calls once a month to make sure that you're getting your refill filled, that we have access to the medication, that it's there for you. And you have a pharmacist right there that's holding your hand every step of the way and going through that process with you.